painful limb swelling that diet won't fix? You are not alone. This condition has a name, but patients wait 15 to 18 years on average for a correct diagnosis. This long wait is often due to confusion between two very different conditions, lipedema and lymphedema. Getting the diagnosis right is the critical first step toward effective management and a better quality of life. In the next few minutes, we will break down their differences, uncover the causes, and show how to manage both. So, let's start with the basics. One is a disorder of fat, the other is a problem with fluid. Lipedema is a chronic disorder of adipose tissue, or fat. It causes a symmetrical buildup of painful fat in the limbs, mainly in women. Lymphedema is a plumbing problem. It is fluid retention from a damaged lymphatic system, and it can affect anyone. Here's a key difference. Lipedema fat resists diet and exercise. Lymphedema's fluid swelling often gets worse through the day. The origins of these conditions also tell different stories. One is often inherited, the other frequently caused by external damage. Lymphedema can be primary, a rare inherited issue, but it is most often secondary, caused by damage from surgery or cancer treatment. But what about lipedema? Why does it appear? The answers are in your genes and your hormones. For many women, lipedema appears or worsens during major hormonal shifts like puberty, pregnancy, or menopause. Beyond hormones, there is a powerful genetic connection. A staggering 60–80% of people with lipedema have a family history. Knowing this genetic link is vital. It confirms this is a medical condition written in your DNA, not a personal failing. While lymphedema can be genetic, it is very rare, affecting about 1 in 100,000 people in the U.S. this way. So, we know what they are and where they come from. But how do they look and feel different? The clues are in the details. The number one visual clue is symmetry. Lipedema almost always affects both limbs equally. Lymphedema often starts in just one. Another telltale sign is where the swelling stops. Lipedema has a distinct cutoff, sparing hands and feet. Beyond looks, there's the feeling. The fat in lipedema is often painful to the touch, and sufferers report easy bruising. Remember that test? It's called the Stemmer's sign. In lymphedema, you cannot pinch and lift the skin at the base of the second toe. Okay, we've drawn clear lines. Fat versus fluid. Symmetrical versus asymmetrical. But the body is complex, and these lines can blur. This is significant. Unmanaged lipedema can progress. The excess fat tissue can overwhelm and damage the lymphatic system. When this happens, the fat disorder creates a fluid disorder. This combined condition is called lipo-lymphedema. This is why telling them apart early is not just academic, it's preventative. Managing lipedema can stop lymphatic damage. Lymphedema carries its own serious risk, infection. The protein-rich fluid is a breeding ground for bacteria. Let's put the pieces together. We started with a problem of time, and we have uncovered a world of complexity. What does it all mean? Remember that 15 to 18-year wait for a diagnosis? Those are years where lipedema can advance, raising the risk of lipo-lymphedema. If misdiagnosed as obesity, a doctor prescribes diet and exercise. But lipedema fat is resistant, so the real condition goes unmanaged. Despite their differences, the path to management for both conditions often involves similar, specialized techniques. The goal of conservative treatment is to manage symptoms and halt progression. Two powerful tools stand out: MLD and compression. Manual lymphatic drainage, or MLD, is a specialized gentle massage. It stimulates the lymphatic system to improve fluid flow. Compression garments are the gold standard, especially for lymphedema. They provide pressure to prevent fluid reaccumulating. Distinguishing between lipedema and lymphedema is not just a label, it is a roadmap. It dictates the right preventative care. Don't wait 18 years for answers. Understanding your condition is the first step. Your journey to clarity and control starts now.